iPhone time. So if you'll all rise and join me in the Pledge of Allegiance, we'll open the November meeting. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay, good morning, and thank you all for coming today. We'll begin with our regular housekeeping items, starting with approval of meeting minutes. We have two meeting minutes, the regular October meeting and then the special meeting from October 25th. Mr. Scribe?
I reviewed the October 12th minutes, and they look good to me, so I'd make a motion to approve the October 12th
I'll second that.
minutes.
Okay, I had a motion by Clark and a second by Jeff to approve those. All those in favor, raise your right hand. Motion carries 6-0.
I was
Absent.
absent for the 25th.
Well, that was maybe the shortest council meeting ever. We had to do one little cleanup vote to correct an error, and literally it was a 1 minute come in, make a motion, vote, and we adjourned. So I think we can feel safe and
I'll make a motion that we pass that.
Second.
have a motion by Jeff and a second by Ron. All those in favor, raise your right hand. Motion carries 5-0, and Mr. Beard abstained. You have in your packet the monthly probation report submitted by Nancy. Another good month. We've had an outstanding year in terms of juvenile detention costs, well under budget. Okay, we have, quickly, moving on, we don't have community corrections?
I don't see it.
Okay. He's in court. Okay, great. We only have one item of new business to consider this month, and that is a library board appointment. It's a reappointment of a position that's already been in place, Mr. Dan Tate. You see we had a letter submitted by Brenda Kinslow, the director of the Colfax Public Library. I did ask whether Mr. Tate could come. He's tied up with work today. You'll recall when we had the same situation with Emily Bunshow with Kirkland, we went ahead and made that appointment and asked Emily to try to come at the next opportunity that she had available on her schedule, and I would suggest that we do that again. This is not a new appointment again. This is a reappointment, and by all accounts, Mr. Tate, had admirably good service. So I would suggest we go ahead and move forward with that reappointment. And we can
I'll
ask
make a
him.
motion, we go ahead and move forward with the appointment.
Okay.
Second.
I got a motion by Mike and a second by Clark to reappoint Dan Tate to the Colfax Library Board. All those in favor, raise your right hand. Motion carries 6-0, and we'll try to get Dan to come in at his next convenience. That moves us on already to our administrative duties on our additional appropriations.
Oh,
Okay, beginning with County General. $523.91 for our half of in a shared payment with the city on a repair to the SWAT vehicle. Now this next one, Britt, I may have you jump in and explain to the council what you were sharing with me before the meeting, because I did have a question about this one myself. $33,547.65. It's reimbursed expenditure for unbudgeted COVID overtime. And well, I'll let you speak to what you shared with me.
That was all of the overtime that we had to catch up on the Board of Health employees.
We did talk about this when she said that. I remembered we had talked about it earlier and agreed or understood that we needed to catch up on that, but we had never gone through the formal process of appropriating the money. So if you review some meeting minutes from a few meetings past, you'll see our discussion about that. But that's Board of Health overtime for all of our folks that had to put so much time in during the pandemic.
And that was like for the entire year.
Right. Commissioners, $12,000 for communication services. I did ask Tim about this. It appears as though we just simply under budgeted last year. There's not been a transfer out or anything like that. Just the bills that came in were more than what we budgeted, so we need to clean that up for the end of the year. Now, there's 3 items here that you'll see. They are actually to reimburse line items where we, earlier in the year, had to borrow some money to pay for an invoice for a repair at the Ivy Tech facility. And we just recently got some money from the state of Indiana for the right-of-way purchased with regard to this road improvement project out here. So that's split between, to put the money back into these lines. $9,000 goes into the county attorney line. Let's make sure I didn't skip there. I think they're out of order. So there's 9,000.
5,000.
Is it the 5,000 also? Okay, 5,000 for Maximus, 8,500 for the official bonds line. I think those are the 3 that make up the total of the state payment that we put back into their appropriate lines.
21,715.
21,715 from the state that we received. And then there's also from the commissioners 2 items that we've talked about on a couple of different occasions. Commissioner Timmons in particular has brought to our attention $3,645 for the maintenance and custodian position. You'll recall we had that person start early so that they could overlap for a little while with Jerry before Jerry retired. So that's to cover that time, and then $4,500 for the part-time employee. We put this person back in the budget for next year, but in order to finish out this 4th quarter of this year, we needed to put some money into a line item. So that takes care of those items. And I think that is all of the county general, and so that's $76,716.56 in total. Then we move on to the Sheriff's Office Accident Reporting Fund, $1,000 from that fund for stop sticks. Then we received some gift monies for the County Home Gifts Fund, $290 that Chris is asking to be appropriated to supplies for residents. $10,000 from Cume Courthouse to pay for fence at EMA. I guess, this is a perfectly appropriate request, but I want to focus your attention to the little note there. So it's a $10,000 request. We started with $25,000 in that account, so after this we'll be down to $15,000 in Cume Courthouse. So that is the one that we've got to watch. We got to keep a close eye on. We'll get a tax draw here in the next 30 days that'll bump that back up, but that's the fund that's the tightest. So we'll need to keep an eye on that. Community Corrections, $250 to sponsor an event. It does not say which event, but to cover that donation. And then from the Sheriff's Canine Fund, $500. We received some donations that were appropriating to the miscellaneous disbursements line item, so that's available for expenditure. And then another $100 donation, so total of $600 in donations to the Canine Fund. Let's see, Janet, this next one, is it just the 1,500 that we don't need? So out of that 10,000, if you look next is Community Corrections, we have $10,000 in total, but the first 1,500 of that, we have a note from Janet, was erroneously included in the additional appropriations and is actually a transfer. So we need to deny the first $1,500 request here, and we'll see it again in the transfer portion.
Okay.
So why don't we go ahead and clean that up? I'd entertain a motion to deny that first 1,500. I got
Second.
John with the motion and Jeff with the second to deny the $1,500 additional appropriation from Community Corrections. All those in favor, raise your right hand. Motion carries 6-0. Then we have, I said that there was actually two there. So we denied the 1,500, but we do have one for $10,000, and this one is being appropriated from Brett's project income fund to help cover some additional expenses for the K-9 unit at the sheriff's department. Or is it his? I'm not sure. Is that the sheriff's or is it his? I guess I'm not sure. It's his K-9 unit? Okay. And then last but not least, one of our occasional appropriations from the Public Defender Board. The Public Defender Commission sent us a check, a reimbursement check for $21,525.72 to reimburse the county for a portion of the pauper attorney fees that we expend in the county. And that is your slate of additional appropriations for November. County Ordinance 2021-17, I'd entertain a motion.
So moved.
Motion to accept, I presume?
Yes.
Okay. Have a motion by Mike,
Second.
second by Clark to approve that with the one $1,500 denial included, amendment. All those in favor, raise your right hand. Motion carries 6-0. We do have a few transfers. From the recorder's office, $275. You see Beth's explanation there to correct a simple accounting error. $275 from computer supplies to service agreement. Veterans Affairs, $1,000 from secretary to overtime. Central Dispatch, $4,000 from part-time to overtime. 'Tis the season when we're filling in holes here. $10,000 also in Central Dispatch from dispatchers to overtime. Then there's multiple very small adjustments in the Highway Department, most of them under $20 for several positions. And I'm not sure why what happened that we needed to make these adjustments, but it looks like we're just correcting some sort of a situation, but five.
I think what happened is we were doing 50-50 from the different funds.
Restricted, unrestricted?
And the rounding per se got off.
Okay. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 different positions that need to have a small adjustment transfer there to get the correct amount in the correct line. Highway Department also $4,372 from Social Security to the superintendent's position. And that's because when Kevin retired, we had to pay out for some vacation days that had accumulated, which left that line short, and we don't want to short Rick, so. Highway Department, $11,000 from PERF to health insurance to cover that for the end of the year. Community Corrections, $1,100 from medical to dental and vision to finish that one out for the end of the year. And the last one, the biggest one is, we have to seemingly do this every year, but on EMS, we have to move some money around to get the correct amount on the salary. So we're transferring from ambulance lease, group insurance, and PERF over to salary, a total amount of $159,686.54.
Alan, I think there was one other that you missed.
Did I miss one?
Federal Superior Court, there was two for
Oh, I'm sorry.
approval and one.
Oh,
two
you're sure.
Not approval.
Thank you for catching that. Two from Superior, 180267 from computers and peripherals to recording equipment maintenance, and 391955 from office furniture to recording equipment maintenance. Any questions or discussion about any of those transfer requests?
I make a motion to approve those transfers.
Okay, I have a motion by Clark.
Second.
I think I've got Jeff with the second. All those in favor, raise your right hand. Motion carries 6-0. There's some other, for your review, transfers that did not require our approval, but as always are included for our review. Two other quick administrative items. Review of the financial report. You'll see that is in your packet after the transfers that we include in our minutes that we have received and reviewed.
There were a few negative numbers that we noticed when we printed it out this week. We cleaned those up, except for on the general ledger. It would require me to print it out in November because we made the changes in November.
Okay.
So in November, you'll see those cleaned up.
Okay.
Motion to approve the financial statement with those comments.
Okay, I have a motion. I'm going to change that to say accept. I don't know if we
Yes,
have to
yeah.
necessarily approve it, but it's been accepted and reviewed.
Accept,
So,
Yes.
Thank you.
accept it. So motion by Clark, and do I have a
Second.
second? Second by Mike, that we've accepted that. All those in favor, raise your right hand. Motion carries 6-0. And then also, I'm not sure if this requires action or not, but I'll take a moment to point out that the auditor has included in our packet a letter testifying that she's repaid the $50,000 that we authorized last month as a loan from hospital contractual to the Board of Health. And we discussed that it was going to be a very quick, short-term loan, and that has been paid back.
I believe Janet typed that up to include two funds. One is the Board of Health, and the other one was,
Oh, it sure does. I'm
Yes.
sorry I missed that. Yeah, the COVID testing grant.
okay. So we've repaid both of those.
And if you'll recall, that testing grant was one where we got the grant, but it was a reimbursement grant, so we had to spend the money first. So we borrowed the money from hospital contractual, paid the money out, then got a reimbursement grant to get the money back.
They borrowed it for like 2 days.
Yeah.
It was crazy.
It was
Yeah.
kind of frustrating to have to go through
It
that,
was.
but that's what that was.
Yes, we do.
Do you want anything in the record? Do you want to vote that we acknowledge that, or just make sure we knew about it?
Oh, I've got it. I'll put
Okay.
it in the minutes, so we'll-
Okay. I don't believe we have any commissioners with us today, so we won't have a commissioner report. Any council reports? Anybody have anything that you may or may not have attended? Okay.
We did get an email from the coroner
Oh, yeah,
last night or yesterday that the morgue is
operational.
operational. Yeah, Clinton County morgue.
And an invitation to what I'm sure is your first tour of a morgue. So, we'll get to check it out. Department heads, any department heads need time with the council? Renee,
You know, usually each year, once statewide 911 board does a review of their financials, sometimes we do get an extra
Oh.
distribution.
Right.
So we did get an extra distribution of approximately, I forget the exact amount, around $62,000. So
good news.
that's always,
Yeah,
we're never going to turn that down,
Right.
ever. So, other than that, I'm helping coordinate Learning to Lead. I usually coordinate that with Nancy Elsey. She's in charge of that. It's the sophomores that, from the 4 county schools. So normally they come to the sheriff's office. This year they're going to come to the fairgrounds. And Nancy wanted to include fire and EMS. So tomorrow we'll have EMS, the sheriff's office. I've got them lined up to come and speak. Frankfurt Fire is going to come to the new training facility
Good.
and actually do a fire training for them to observe and watch them do a fire out there as well. So
Okay.
working on that. So we'll have that tomorrow.
good news.
Then the only other thing, Curtis Herring, as a shift supervisor, is here representing the department as well as me. I'm sure you'll know, I'm just asking for an update for the ARP and where we are on those things.
Well, and I think you asked for that at the commissioners'
I did,
meeting
yes,
as well,
yes.
and they informed you that we just weren't ready for that yet.
Yes.
And I can be very frank, one of the things that we need to know before we can move forward with any expenditure out of that is that we're waiting for our distribution from the federal government of our EDA grant, the $3 million grant that we received, and our fallback position. So I'm getting into the weeds here a little bit.
You're fine.
But when we did our project for 28 and 65, we borrowed short-term money, and then this past summer, we did long-term bonds to finance that over a long period of time. When we issued the long-term bonds, we issued the amount we needed to repay for the short-term money, less $3 million that's gonna come from the federal government and the grant. We'll put that all in the pot and pay off the short-term money. We haven't received that yet, And our fallback position is that the ARP money is what we would cover that with in the event that it doesn't come in time before those short-term bonds are due. So our short-term notes are due, which is in early January. So until we get that money from EDA, and the update we got last week is that we had crossed the final hurdle, and the payments had been, or the disbursement request had been submitted, and now it's, I think, just a function of how long it takes the government, federal government, to turn around and give us our money. We'll know something. But until then, I'm loath to spend any.
We just want to
No, I
make
wanted
sure
to-
it's
I
still.
haven't
yep.
forgotten about it.
No, no,
Um,
and that's what, I wouldn't be doing my due diligence as a
understand.
department head. And
Understand.
I'm not only speaking just for central dispatch, and it's not my place to speak for other departments, but again, it's countywide for
Right.
employees, so I'm just doing my due diligence
That's
as
where
well.
we are.
Yes, so I appreciate it.
Okay,
All right,
thank you.
thanks.
Thanks, Renee.
Any other department heads? Okay, we have some other folks. Jamie, Anita, anybody need time with the council?
Do I have to go up there?
Well, if you would, because it picks up for the people watching online. They can hear you when you speak into the microphone.
So I'm Jamie Pratt, the Center Township trustee, and last week on Monday, we opened the Home for the Night shelter. We have been to the county commissioners and the city council to ask for some money to cover some staffing costs for the first year. Jada and Anita and Laura and myself were just kind of going to give an update. We're a week into it. We've had 6 individuals apply for the Home for the Night. 4 of them have actually stayed, and I believe 3 of them have done wraparound services with Healthy Communities. And we have one other person that's going to be meeting with our coordinator from the jail to come in as well. So we were just wanting an update to see if we could get the city, I believe, has said they would give $22,000. I have reached out to the other trustees, and I've only heard back from one.
Okay.
And they had to talk to their board about it. So that's the only information I have from the other trustees as well.
One thing I would ask you could help us with is as you get people staying, it would be nice to, just privately, this does not have to become public
Okay.
information, but I would like to know how many would be county residents versus city residents. I think we need to track that over time.
Yeah.
Because I think that could be helpful information to go to these other township trustees with,
Yeah.
rather than just come with a handout,
And that's what I planned on doing. So far, out of the 6 individuals, one of them was a Kirkland Township resident. I'm not for sure about the one that's coming from the jail. We've not received her application yet, but the other ones were City of Frankfort residents.
Okay.
And they're not the typical ones that I see in my office. They are ones that I didn't even know about, because we have frequent homeless that come into my office, but these individuals aren't ones that we see on a regular basis. So I was kind of surprised by that. Honestly, I figured it'd be the ones that we see on a normal basis, but.
So you gave a little bit of an update there. I was going to ask the question. You have talked to the city. The city did move forward with half, because when we talked last month to Jada,
Yes.
The discussion with the city hadn't happened yet, and Josh made it clear that we were going to try to see if there could be a split.
Okay.
Okay.
Thank you.
We all have our little parts that we do here. So as far as the city, I actually spoke with Eric Woods yesterday, and the city actually gave the mayor $50,000 to do whatever she wants with non-for-profits, and she is designating $22,000 to Home for the
Okay.
Night. So
Half
that's been
of the
confirmed,
request.
yeah.
Okay. Josh's request to us last month was that we fund that, do half as well, and that it come from the landfill. If you'll recall, he suggested the landfill, which I think is an appropriate place. Were you going to add to the?
I was just going to explain about wraparound services so that everybody
Okay, yeah, please.
understands. So the 4 individuals who have stayed, 3 have accepted wraparound services. So we verified that all 3 have health insurance. We've applied for SNAP benefits for all 3 of them. We've applied for long-term housing solutions for 3 of them. 1 is already accepted into long-term housing. And then we are also helping 1 who was a victim of domestic violence get some services there, and hopefully get her disability back. She was on disability, but left that relationship and so didn't get her renewal paperwork. We have a law firm who's willing to do it for $150, which is nothing.
Great.
And we're working with the YWCA in Lafayette to see if they can pay that amount through their domestic violence funds. So 3 of the 4 have accepted services, and I think that lends to long-term stability for them so that they're not going to be coming back into the homeless shelter over and over again. So working on long-term solutions for them.
Okay, great. Thoughts, questions, comments?
Well, can I just, so I'm on the Board of Healthy Communities, and we will give personally to Healthy Communities, and we love everything that's going on there, but can I understand this better and say, this is gonna be harsh, but is this really the role of county government? And I'm not saying that we're not doing anything, but I just want to just be clear, is this more of a township
Yeah.
problem or a solution?
Jamie, help us educate us here, because you're the trustee in the room. Townships are responsible for indigent care, correct?
Yes, so if an individual is homeless in our township, we have to consider them our residents. I've given money through the township to the shelter, and we're actually running it through my office. And we do everything we can, but our dollars are limited to Center Township only because we're funded by Center Township. And if I'm being honest, a lot of the other township trustees don't work very well with my office. They don't think they have a whole lot of homeless individuals. And it might just be because they're smaller townships and they don't see them, they don't do a lot of services like we do, I don't know. But I did reach out to them several times and I have not heard back. And my only question is, if townships weren't here, because we have been on the chopping block, at the state level several times, I don't know who would take care of them, or whose shoulders would it fall on then. And we're not, I don't mean to be rude, but we're not asking for a whole lot. They've applied for grants, and we have grants that we can apply for next year, but because we are a new organization, we can't get them until we're established. So,
My statement was just trying to figure out, what is it that we do?
yeah.
And the county does say yes to healthy communities, and that's really, so, your statement, like, who else is gonna give it, I'm not taking that as negative or anything like
Yeah,
that.
I
totally
appreciate.
agree with you.
Appreciate the education, and you
Yes.
mentioned having someone from Kirkland Township. Well, I'm a taxpayer in Kirkland Township, and I find that very frustrating that I'm paying a tax rate to Kirkland Township that's supposed to cover indigent care, and now I'm gonna pay for it again, at the county rate. And so I'd like to, I think we should do something to help get this program started. It's obviously a worthy program, we were all supportive of it. But I also feel like for longer term, we need to be having discussions behind the scene, and if the county government can help motivate some township trustees, then I'd be happy to be a part of that discussion.
I would love that. I mean, I've tried several times to reach out to them, not even for this issue, but for other issues, and I just don't get responses back. And Jeremy from Sugar Creek Township, I actually seen him at the fire department, so that's how it come across with me. And I do have current emails because I take them from the emails from the auditor that's saying, hey, your checks are here, so I know they're getting them. I just feel like they don't think that they have any homeless individuals. They don't feel like they need to address it.
Particularly when so many of them have such a healthy cash balance.
Yes, yeah, it's frustrating, but, we wanted to do something whether there are actual individuals or not, because,
Okay.
The nice thing is we have a software system that's collecting a lot of data for us. So we'll have some ammunition to be able to go to those other trustees and be like, this many of your people came in, you
Yeah.
need to step up.
And that's what I was thinking that way too. I think that would be very helpful. Is there a will among the council to go ahead and match the city, at least for that first year startup, get them off the ground, help them be as an existing going concern that will help them with future grant applications? I would be in favor of that.
Well,
How do you-
I would like to make that motion, since I'm the one that talked like that, because this talk is really about next year.
Yeah.
I'm saying, yeah, let's help out, let's do this.
I would
That-
also-
My motion is yes for the 22,000.
Give me a second before I say anything.
Go ahead. No, go ahead.
I would also say, being a pastor, that I'm in the same boat as Jeff. We kind of want to know what our role is not just doling out money, but it's not just for homeless. It's also kind of a means of gathering, like you say, gathering information. And if it was just for the homeless shelter, I'd probably be a little bit more against it in the sense, but I don't know if that makes sense, but it's actually, I'll give you an example. Back in Bismarck, when I was pastoring in Bismarck, when people would come to us asking for money at the church, we actually supported an organization like this. It wasn't just a homeless shelter. It was a structured system that when they came in, they could go into this shelter, they could get some, not just a bed at night, but they got some nursing care, they got some follow-up on what they're gonna do in the future. And they kept a database so that I could actually, as a pastor, call and say, hey, Jim just came in, and he's asking for help. And she would say, well, Jim doesn't need any more help. It was in a database system. So it really was a good thing for the community, because it really, I don't know if that makes a lot of sense, but it really was keeping track of the information so that we really were helping the people that needed help, not the ones that were abusing the system. So I had a conversation with, after the last session there, but this, I think this is gonna do that, from what I was told.
And we did provide medical care for one of the people that came. I have to be careful because I hit the laws, but we did do some medical testing and a procedure for one of those three.
So I had a fellow that come to me, for example, and asked for help. I contacted the shelter, they took him in, gave him a place to stay, got him clothes on his back, gave him a medical situation, got him a job. Actually, some people come in and do the job interviews and stuff. And so he came back to me about 2 or 3 weeks later and thanked me because now he had a place to stay, he had a job, so he had some kind of a future going for him. So I think it's a good thing.
Well, can I ask, so of some of the tough questions that we may ask, are you asking those questions when people come in? I mean, yeah, so you kind of understand that role too then?
Yeah,
is-
I mean,
Yeah,
I try to be diligent with the taxpayer dollars, and I do understand, we do have people that come in our township that are frequent visitors in our township and in my office. And I'm like, what is your plan? We can't keep on using taxpayer dollars for this purpose. And they realize that, and one of the people we had over the weekend at the shelter, he didn't want to utilize I got called twice from the police department about him, and he didn't want to utilize their services. So I am making sure that I am using the tax dollars the best that I know how. I try to keep holding them accountable. They have to do work fair. They have to do their wraparound services, or they're not staying another night. If they choose to do that instead of sleep in a bed, that's on them. But we do everything we can do.
thanks, Jenny.
The big thing that we keep saying is this is a hand up and not a handout.
Right.
Yes.
The frequent flyers, they're not gonna enjoy our program because it's not something that you can continue to do.
Very
Give it
good.
a couple tries, she may not get it the first time, but you'll get it, you'll have points to continue to stay there. So
We did have one
Thanks.
individual that applied that did not come to the shelter because she didn't want to do what we asked of her. So, I
Very
mean,
good.
we're just not gonna get the bed to sleep in just to hang out. Have a warm bed. I mean, it seems cold, but if you're not gonna do what we need you to do, there's no point wasting taxpayer dollars in that way.
Okay, thank you.
Trying to make long-term solutions.
Right.
You know.
Right. So I interrupted there. Jeff had made a motion to support. Was that motion from landfill?
Yes.
Okay.
Yes.
So I had a motion. Do I have a second? I think I've got Ron with the second, that we support the homeless shelter with a $22,000 contribution for, I guess that would be effective immediately.
Immediately?
Whenever you can get that advertised, Brett. Can we do additionals in December? I can't remember. Is there?
We are having our meeting one day before
Okay.
they're due, so we're fine.
Okay, so we can go ahead and do that for
Barely.
December. And we'll go from there. All right, so I have a motion and a second. All those in favor, raise your right hand. Motion carries 6-0.
Very good.
Okay, Rodney, did I not see, I did,
Department head, but
you were
Yeah, that's all right.
hiding back there and I didn't even see
That's
you.
all
I'm
right. Just
sorry.
real quick, as you had mentioned earlier, many thanks from the department and the board for initially the 50,000 in April, May timeframe when we were running short of cash funding at the time due to last year's shortfalls, but then also to help with that short-term loan to us to ensure that we would have additional COVID funding. So we're continuing to be, as Jamie says, good stewards of grant monies. that is in the system currently working with Britt. As you well know, we have revenue coming in from administration fees for many of the nearly 14,000 vaccinations we've done or more now. So, and we continue to do so. We're now doing younger children here starting tomorrow and booster shots. So,
Rodney, would you take a minute?
Sure.
Because this is something you and I have discussed a fair amount, and Brett, we've worked on, but explain to the council about the administrative fees, because I don't think that they know.
So early on in all of this, we subscribed to the idea that there would be many different insurances of different types available that would be required by the federal government to pay what's called the administrative fee. That helps to lift some of the burden of all the additional hours of work, staffing, volunteers coming in, administrative costs that are involved with doing these clinics for now going on. Well, we're in our 10th or 11th month. We've been doing testing for 20 months. So we're talking quite a tremendous amount. So early on it was set up that, you know, the federal government passed it down through the states that we were going to be billing Medicare, Medicaid, private insurance, public funding asset monies, such as 317 grants. So all of those funds were integrated into the system that we're using. We cursed the system because, you know, it's something new to learn. It's not paper forms. It's much more labor intensive. It's cost us a lot more volunteers to actually get people registered. But it did do two things. It helped us with billing. The State Department of Health and the state of Indiana have been our judiciary to set up a third-party biller, and they have been billing all of these different private and public insurance companies for administration costs. On an average, I think if you give the person both series doses, and now we're talking boosters, which will be a whole new revenue basically stream, but it was about $40 per person for the series of 2 shots typically. So we're just now seeing that money coming in.
Okay.
I think we got the first installment maybe a month or so ago here now. We're still working, I'm working with Britt and Alan to best set that money in place so it won't, how shall I say it? We don't want to see any normal funding stream and funding from any type of levies be affected by it if possible. But I want to work with Britt and I want to work with Alan and the SBOA and the EIGIO and the DGLF to make sure. So when we first saw some problems, I reached out to a friend of mine, the Deputy Commissioner of State Department of Health, Pam Pontonis, and said, hey, look, you need to get the State Department of Health, you need to get SBOA and DGLF all together talking on this and give some guidance to the counties because, you know, this is a critical thing. We've seen 160,000 come in already. And I anticipate at least that much more, if not more, coming just from our initials. So that's a fair bit of money and the real intent of it from the public health standpoint would be to build for future infrastructure.
Yeah, and I might add, so the letter came from the State Department of Health, you know, encouraging county departments to take this money, which is bonus money in a way, and use it for that longer term infrastructure, you know, invest it. And our fear is that if that money was receipted in, just put into the cash balance in the health fund, that DLGF would say, well, you've got lots of cash, you don't need your regular tax rate. So we're just gonna cut it, and then it would be spent next year on ordinary operating expenses. And so we've had a number of emails exchanged with both the Board of Accounts and with the Department of Local Government Finance and the State Board of Health, and we've been trying to figure, and of course, we're not the only county dealing with this
Certainly
issue.
not, yeah.
And so we're to the point now where we as the county officials, we've just been kind of encouraging all those state departments to talk to each other so that there was one message to the counties, because we were getting different opinions from different departments on what the impact and what we should do with that revenue. But as Rodney says, we you know, we've received 160. We think it could have that much again, and then we've got boosters, and so we're talking about the opportunity to do some real good.
Yes, significant
for the
change
county.
in the future of public health. But again, I want to make it clear that, you know, it's really important that those state entities tell us the same story because we need to work together as the community, as the county. We don't want to be pitted against each other on this. And in this case, I want to make it clear, you know, Britt has bent over backwards to make happen things. For instance, let's say, for instance, testing grant, just for instance. I got the grant paperwork in place. She approved all of that. She made it happen immediately. We hired folks in September of last year to start doing testing, okay, additional testing that we are doing still now. If we had waited until that money was actually in our pocket and we weren't going negative on cash, we would have been delayed till January. That would have been that much longer that we would have had to wait. That's not our fault. That's the state and the way they do grants and the way they push out the initiative to get going without keeping the money up ahead. So my hat's off to her that, you know, and in some cases, she kind of took it on the chin from some of those state entities when they came back through and said, hey, well, wait a minute, we shouldn't have done that. But the same's true of the vaccine campaign as well. Had we had to wait for that money, again, we would have had delays in vaccines getting out to folks. So I want to take my hat off to her, right or wrong or indifferent. She did what was best for the community and may have received some less than favorable remarks from the state on that, and it's all for the benefit of the community, and I think we really owe it to her to try to keep working with her and make sure that doesn't happen again. In retrospect, I would say maybe I should have come and asked the council to give that loan ahead of time to keep us out of the red and grant emergencies like this in the future. So that's just my input to you guys. I'm very thankful that we had Britt working with us during this time because, you know, that's major delays in services that we would, you know, that cost us information on testing and then later on in vaccines. So,
Well, let me be clear, we didn't do anything wrong.
no, not at all.
We just were in a position where we had the left hand not knowing what the right hand was
Yes,
doing at the state.
it's the state saying go out and get something done. In the meantime, saying, well, wait a minute,
Yeah.
we have a procedure here we're supposed to follow all the
One
time.
saying
and
go, 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 the
Yeah,
other one
yes.
saying bureaucracy, you need to.
And
do
again, I'm
paper.
certain that costs certain communities, you know, response time. You know, that's the bottom line on this. And we are, after all, working in emergency circumstances here, so we need
Learned a lot.
We learned a
We
lot.
did
and the
learn a
state
lot.
learned a lot. I think.
Yes,
I think
yes.
we've done our part in trying to educate the state on
Yes.
the challenge that the counties have on administering this, so.
And so back to your point, though, it is that the intent of this money is to try to build a future infrastructure for public health in each community as well. It's a rare and probably unprecedented chance to get funding into the public health realm that we normally would never have the opportunity to do so. So, but I wait to defer to you folks we'll wait and see what guidance we get from those in power at the state. But again, I think it's best that we all work as a team to do that. We have a fund in place indeed in case they determine that, on all parts that we can put that in another fund, then we can do so. But and then we can work from there. But again, we do have on the books, and I haven't gone with the commissioners yet, but $220,000 available coming in the next probably month or so to work with schools. And while we've signed a letter of intent, I still want to see how they unfold some of the issues we've already come up with, because that's additional monies into
Will we use our new trailer?
we have been using it actually, and what we're looking at, what they're looking at is, what's happened is they have hired 5,000 people many months ago to help with close contact tracing because they wanted to do it. The locals were already doing it and they wrestled it away from us and they wanted to do it. So they've been doing it all this time, but as in all situations, now they want to decommission those 5,000 and starting to push it back to the counties. Well, the first perception they are is, well, we're going to give some money to you to try to hire some extra folks to help the schools with testing or with contact tracing, and their hope is that we can influence the schools as far as what they want to do, masking and otherwise too, but we're not, we're a little concerned that the hook's a little bigger than the bait on this one, so we're going to try to work with you folks. But it is available, as in everything when funding available, we need to be very prudent with what we say we will agree to do and how much it's worth to do so. But again, lessons learned, we're going to keep trying to work for the best benefit of the community. The other thing I wanted to mention again was the event occurred. I know Ron was there for certain over last week here. It was, I think, very successful event. Laura can attest to as well. We just wanted to thank the commissioners and the council for helping support that. I think it was a great opportunity to tell hundreds of volunteers who gave thousands of hours that we were very appreciative of them being there to help us do that, so we thank you
Good,
for that.
Very good.
Thank you for the update, Rodney.
Certainly, thanks.
Anybody else need time with the council?
I just wanted to say, Rodney won't brag on himself, but I would brag on him a little bit. He's one of less than 5 counties in the state that has also figured out a way to do presumptive eligibility. So he's partnering with us so that those people who come into the clinic to get vaccinations, if they don't have insurance, we can do presumptive eligibility on them through Healthy Communities, and then that way you guys do get that $40 administrative fee. That was something that actually rolled out right before COVID started, and then when COVID hit, like, everybody just kind of ignored that. But Rodney is one of, I know that there's 3 doing it, 2 others working on it in the whole state, out of all the counties. And because we have a higher undocumented population, that means a lot of money really for the county, and he doesn't brag on himself, but that was a lot of paperwork and a lot of time to get that done, and his staff made that happen, so you guys are recouping more money on those admin fees than a lot of counties are, because you're getting presumptive eligibility people done, so.
You know, and that's a good point. We just appropriated $30-some thousand for overtime, and we've gotten back 160 so far. So kudos to you, Rodney, for making sure that we're in place to take advantage of that.
Well, again, one of the things I want to say just real quick is we have seen many-fold benefits from being a partner with Healthy Communities. Just a normal day operation, let alone with this COVID situation. So what we thought was going to be a really great relationship was proven very quickly to be so. And I think, again, that's going to benefit the whole community.
Well, thank you all for coming and for sharing. Today's been educational on multiple subjects, so I appreciate you taking the time to join us. Last call for business in front of the council. Thank you all for coming.